A lot of bodybuilders and athletes often suffer from joint and connective tissue pain, and they wonder about possible supplements that might help ease the pain or aid in the recovery of injuries related to joint problems. Probably the most popular supplement in this category is a supplement called glucosamine. And there's a lot of controversies about glucosamine. A lot of studies that have it's often suggested to treat arthritis. Arthritis basically is an inflammation of the joint, often caused by the wearing away of joint surfaces. And glucosamine is often recommended to treat arthritis. But the studies that in which they've given glucosamine to treat arthritis are often contradictory, with some studies showing definite benefits, others not, no benefits. I'm going to try and clear this up in this video and explain to you, and maybe we can come to a conclusion to see whether glucosamine might be of use in helping to heal any joint injuries that you might have. Okay, what is glucosamine? Glucosamine is what they call an amino sugar. That means it's a combination. It's actually made from glutamine, the amino acid, and it's combined with a sugar, and so it's called glucosamine. And what does it do? Glucosamine is a component of a joint material. This material that helps to make up the structure of joints is called I can't even pronounce it. Glycosaminoglycans. You don't have to remember that. I think they sometimes refer to it as GAG, and it's basically a structural component of joints. And the thought is that by supplying glucosamine, you're basically providing the raw material for either the rebuilding of joints or the protection of the destruction of joints. Okay, now the commercial glucosamine is made in the body, as I said, from glutamine, but commercially, the commercial glucosamine supplements are usually made from crustacean or shellfish, or another possible source is bacterial grain fermentation. So those are the sources of commercial glucosamine. Now, a 2007 study that was in vitro, which means that it involved isolated connective tissue or joint cells, it found that supplying glucosamine increased collagen synthesis. Now, collagen is the underlying primary structural protein of all connective tissue. And in this study, providing glucosamine increased collagen synthesis. It increased the production of another bone-building protein called osteocalcin, and it also increased bone mineralization, or the incorporation of minerals like calcium and phosphorus into bones. Of course, all of this would be very beneficial for bone mass and possibly joint protection. Now, it also, by the way, a secondary effect of glucosamine, why it would help especially in terms of pain management, is that glucosamine lowers several inflammatory factors that induce pain, especially in the joints and actually in any tissue. These include tissue necrosis factor alpha, TNFA alpha, interleukin-1 beta, and prostaglandin E2. All of these things are very inflammatory, and they're modified by using glucosamine. Now, for a minute here, I just want to discuss one of the main controversies about glucosamine, which is why, like, half the studies show it works, half the studies show it doesn't work. There's a couple of factors to consider. One of them is the type of glucosamine. The only type of glucosamine, this is very important, the only type of glucosamine supplement that actually works is glucosamine sulfate. There's other kinds, for example, glucosamine hydrochloride or glucosamine HCl. That does nothing. And a lot of these joint supplements that were used in these studies and that are taken by people who say that glucosamine doesn't work, if you look at the label of the supplements they use, you find it's glucosamine hydrochloride. Glucosamine hydrochloride is basically garbage. It doesn't work. It's not absorbed well. Glucosamine sulfate has a 90% absorption rate. There's a big difference. Another factor to explain why some of these studies show a null or nothing effect from glucosamine supplementation is because your joints have a very poor blood supply. Muscles have a huge blood supply. Muscle injuries tend to heal much more rapidly than joint injuries for that reason, because of the greater blood supply in muscles compared to joints. But as a consequence, it takes some time for glucosamine to be incorporated in joints when you use it orally. I think it was a 2008 study actually showed it took a minimum of 8 weeks for a glucosamine supplement to reduce knee pain in people who used it. It took 8 weeks. So I always tell people, if you're going to try glucosamine, you got to give it some time. It takes time. I would say no less than 2 to 3 months before you'll notice any benefits. And a lot of these studies that examine the effects of glucosamine on joints, they only lasted 2 weeks or a month. That's not going to do anything. Of course, they're going to show no benefits. Again, the glucosamine sulfate is the best form to use. The typical dosage is 1,500 milligrams. You can use up to 2,000 milligrams with no problems. And again, it's 90% bioavailable. Another problem with glucosamine supplements is a problem that's involved with that a lot of supplements express, which is quality control. In other words, to put it very simply, a lot of supplements don't provide you the nutrients that are listed on the label. They either have too much or too little. And as I mentioned, this is also a problem with black market steroids, as I mentioned in a previous video. In the case of glucosamine, there was a 2002 analysis of glucosamine sulfate supplements. 14 supplements were included in the study. The study found that the content of glucosamine in the supplements varied from 59 to 138% of label value. So that's another problem. So, I don't know what the solution is, other than to try and, if you're going to buy or try glucosamine supplements, get it from a reputable company, hopefully that does analysis on its supplements to assure you that the content reflects the label amount. Now, glucosamine is often administered with another substance called chondroitin sulfate, or CS, chondroitin sulfate. Chondroitin sulfate actually tends to increase fluid in a joint, so it'll help retain a little bit of increase like joint fluid. So in that sense, it acts as a kind of a joint buffering action, and it also works synergistically with glucosamine sulfate to help heal joints. So it's a good combination. You would take about maybe half as much chondroitin as you would glucosamine. So if you're taking 1,500 milligrams of glucosamine sulfate, you'd probably take about 750 to 800 milligrams of chondroitin for best results. The problem with chondroitin is, again, a lot of it is not good quality. And the other problem with chondroitin is it's not quite as absorbable. It's a little bit harder for the body. It's a large molecule. It's a little bit more difficult for the body to absorb compared to chondroitin sulfate. Now, another thing that I would recommend if you want to try something, and I've used this myself, is a combination where you take chondroitin sulfate, you take glucosamine sulfate, chondroitin sulfate, and two other nutrients. Actually three. One of them is called MSM. MSM is basically an oral form of an old drug that was used topically called DSMO. MSM has a lot of anti-inflammatory effects. I'm going to have a huge article on MSM because it has some interesting properties related to workout recovery. I'm going to have this in my Applied Metabolics newsletter. And I'd also throw in two other nutrients that might be of help. One of them is called boswellia. Boswellia is an herb, and it inhibits some of these inflammatory mediators that cause joint pain. So it'll add to the pain relieving effect of the glucosamine and the chondroitin, and it also works a little faster than the others, so you'll get a little bit quicker pain relief. And the final thing I would also throw in a joint healing program or joint prevention program to prevent damage to joints is fish oil. Because the reason you throw in fish oil is because fish oil has a anti-inflammatory effect, and it's always good to take for any type of inflammatory condition. Now, there's been some controversy about glucosamine causing insulin insensitivity. And some doctors have suggested that it be avoided by people with blood sugar problems, for example, diabetes and those with insulin insensitivity. However, most of these negative effects were shown to occur in animal studies, such as studies involving rodents, and they also involved injecting glucosamine. The oral supplements of glucosamine, you'd have to take a lot more than the dosages I recommended to have any effect on insulin or blood glucose. So I would say it's not something to worry about. Uh, what else can I tell you? Interesting. As far as the athletic studies go, there hasn't been a lot of athletic studies, but interestingly, the few studies that have examined the effects of glucosamine in athletes with joint problems shows that they tend to work better in athletes than they do in people that don't exercise or in inactive. Nobody really suggests a reason for this. My guess is it's the actual activity involved in sports or exercise that increases the blood supply to the joints and gets the glucosamine into the joints more effectively. This might explain why glucosamine seems to work better in athletes, bodybuilders, and people that are active. There was one study with soccer players which showed that glucosamine definitely improved joint healing. The same authors later did another study with bicycle racers, and I have the study here in my hand. What they wrote was glucosamine exerts a chondroprotective effect by preventing type 2 collagen degradation but maintaining type 2 collagen synthesis. Together, these observations indicate that glucosamine may exert a chondroprotective action by preventing type 2 collagen degradation in athletes of various sports. So again, the good news is that glucosamine seems to work better for people that are active in sports or exercise. Another interesting, I'll leave off with one other interesting aspect of glucosamine. A study published a couple of years ago, it was an animal study, but it showed that glucosamine seems to offer life extension benefits. It actually extends the lifespan of animals. The authors really weren't clear on why glucosamine was able to do this. They strongly suggest that the same effect also occurs in humans. In fact, there was another study done a couple of years ago where they examined about 30 popular supplements and to see how they would affect human lifespan. And the only one, I think it was only 2 supplements actually showed any real effect. One of them was glucosamine. So there's something about glucosamine that tends to extend your lifespan. I have a study coming up in my Applied Metabolics newsletter related to this kind of aging effect. I'm going to talk about some brand new studies about how glucosamine may actually decrease facial aging. That's going to be in my Applied Metabolics newsletter. It's a little bit too complex to talk about here in this video. And I've already way past the point of what I call troll attention span, which is only, 10 seconds? So I'm going to end it here. And I also suggest anyone who wants any information, up-to-date, state-of-the-art information on nutrition, exercise science, anti-aging research, ergogenic aids, fat loss techniques that work, all this stuff, is in my Applied Metabolics newsletter. It's 40 to 50 pages every month. It's more like a monthly ebook. There's no ads. I'm not trying to push any products. Among the articles coming up, I'm going to have an article on a type of natural sugar that almost nobody knows about that actually helps you burn fat. This is a sugar that actually helps you burn fat that I don't think anybody knows about. It's going to be in my Applied Metabolics newsletter. I'm going to also have features on fructose, the truth about fructose, on and on and on. I have plenty of articles about the effects of some popular drugs that are used in sports and bodybuilding. I don't recommend drugs. I don't give out drug cycles because that's unethical. But I do discuss medical studies pertaining to that. I have articles also for women. For example, in an upcoming article, I'm going to discuss the full effects the full and complete effects of anabolic steroids in women. I'm also going to discuss the ultimate guide to cellulite, which is actually much more, it's a type of fat much more prevalent in women. This is all going to be in my Applied Metabolics newsletter. It's not going to be anywhere else. You won't find this type of information anywhere on the internet, no blogs, no magazines. It's only Applied Metabolics newsletter, www.appliedmetabolics.com. If you want the best friend you'll ever have, go out to a shelter and adopt a dog. They are the greatest animals in the world. Chip's been very quiet. He's been here the whole time. He hasn't said anything, but take care.